Cynthia, and it's exciting to be part of this showcase because Startup Health was there at the beginning, just over 4 years ago when we started out on our mission. And I remember people telling me, like, this is not possible. And I said, well, if we imagine it was possible for a moment, wouldn't that be wonderful? And so it's great to be able to come back now, years later, and say that we have a number of organizations working with us that are experiencing the kind of future that we're excited to bring into healthcare. And so I'm a practicing physician, family doctor, used to be an emergency doctor, and I was part of the wave of people who helped computerize healthcare in Canada, around from paper records to electronic medical records, and then got involved in building some of the first telehealth direct-to-consumer type of solutions. And in all of these different projects, which were successful, um, I met some interesting people. We came together with my two co-founders and asked ourselves, like, wait a second, now that we've experienced all this progress, what does the future look like? And with Alarm, we looked at 250,000 new apps in the App Store in the last decade, and yet usage remains an issue, and the average patient gets overwhelmed because more patients survive more with more conditions, there are more options, but it's all chaos. And so we looked at banking as an inspiration, and we said they have had this evolution. They went from an organization having to make you come into the bank, be in there in person, to then be able to get money out of an ATM, to be able to go online and check your report, to now being this omni-channel type of experience. And what and how can we do there? We went back to healthcare and they said, sorry, we're so busy, we're so overwhelmed, half of the profession is burnt out. So if you're in innovation and you haven't had this experience, um, call me, because that's the usual. But we talked to a number of people who were interested in figuring out, how do we take a system that's not a system, that is a collection of departments and programs looking at the patient from different perspectives and imagining what they need to know about that person, into something that starts recognizing that each one of those patients represents a patient like the ones that I treat. They have different medical conditions, but they also have hopes, dreams, and aspirations. And what we're doing to them in the healthcare system is we're looking at them from the lens of each one of those entities, whether it's healthcare, primary care, insurance, pharma, home care. We've digitized each one of those, but we still don't understand that patient and their experience. And so getting back to the patient, let's take Mary here in the middle. She has a primary care physician, probably some specialty care, other services, allied health, insurance, pharma company, patient associations, home care. But the other aspect that really matters to her life is she's got best friend who's very involved in supporting her, her daughter, and she can also choose her own apps and devices to add. This right now looks like chaos, but what if Careteam came in through a specialty care or insurance or pharma provider and gave her a clear plan of action for one of her conditions, and then allowed her to onboard whoever she chose to onboard in supporting her care, her best friend, her daughter, apps and other devices, and then started creating connections, almost recreating the healthcare system for the bottom up, which is a challenge right now because otherwise you would need to go top down, make agreements between all of these organizations. And we all know that that takes forever. So Careteam has created that capacity. And not only is that a good idea, but it's a huge opportunity. The advisory board looked at how many interactions on the average happen inside the hospital, in clinics, home and community. And the number of interactions in the home and community is 99% of where healthcare gets delivered. And yet there is no system that connects across that. And that's the kind of system that we are building at Careteam. That implies that we connect well to EMRs, EHRs, PHRs, digital front doors, telehealth, remote devices, as well as the consumer side of apps and tools that people are building. And where we are on that journey is we've done a number of integrations already. We're planning a number of other integrations to add into the omics and wearables and IoT devices, all with the lens of saying, all of this put together is not enough. We need to be able to create a care plan that is based on templates, based on evidence, but each clinician can customize to their particular view of how care should be delivered and then personalized to each patient. And we should be able to implement that plan, understand what works, what other devices and apps and tools need to be plugged into it, and then analyze the overall, get this 360 around the patient and understand what's needed. So the core Careteam app is built with two sides, the patient side and the clinical side. Each one of them meets all of the healthcare requirements that need to be in place. We solve one of the big BAA problems around how do you get to collaborate across organizations, because the patient is the vector that enables that. And it allows you to create a flow from personalized action plan to inviting everyone who needs to be invited and understand who's who and what are they doing, seeing the progress, adjusting and communicating as needed, sharing any information and resources, and then engaging the patient with smart check-ins and forms and other tools to see and get patient-oriented outcomes, patient-oriented data, and real-world evidence. We have a solid team of people who have led major implementations, and we've combined the four sort of mindsets of clinical, business, and adoption and technology in order to produce something that just right now doesn't exist. And are looking for innovative health organizations, insurance and pharma companies interested in solving their biggest challenges. We've worked in dementia, cancer, addictions, eating disorders, type 1 diabetes, and recreating a completely new way for the patient to experience the healthcare system. That's us in a nutshell.
Thank you so much, Alexandra. I love your intro. You've always been such a positive member of our community, and that kind of positivity is obviously what it takes to make it in this industry. So you're doing a lot with your platform, which is the idea, right? To have everything centralized. Can you detail a little bit more your business model? How does the business model side of the business work?
So we've built something that is enterprise grade because that's what our experience was before. But because of where technology is today and cloud-based services and connections to other providers, it's all SaaS-based and it's all a flat fee, so that we can actually sell the enterprise level entity to a team for a small price. So our starting price is $100,000 per department with 2,000 plus patients. And say, instead of you hiring one more person to do care coordination and asking them to take care of your tip of the pyramid of the most complex patients, why don't you give your entire team a tool to be able to engage with your patients more effectively? And so it's a flat fee. And once your organization is deployed, the patient can invite their community pharmacist, social worker, best friends, family members who don't even live in the same city, who need to be engaged and involved, and it's all costing the same.
Awesome. That sounds like a great model. What are some examples of some of the conditions that you've really helped so far?
To me, one of the most fascinating ones was aging and how COVID transformed that experience, because we went from, that's nice to have in the future, to, oh no, we need this right now. And so in one of our implementations is a tertiary care geriatrics department that's collaborating with 39 community organizations around who's doing what to support an elderly person at home. And half of those patients, the family members are not in the same city, but they can be involved and up to date as to what's happening. And so that true collaboration across, I have never experienced in my clinical life. And it feels like the future is here.
That's awesome. Yeah, we've seen such an amazing moment in the last year for our industry. Anything else that has been really remarkable for your company in terms of how COVID has affected you?
One of our customers is a eating disorder clinic called Body Brave, and they, instead of shutting down where everybody else said, sorry, we can't see anyone, responded to the real need that they were seeing, and they went completely virtual with their patients. And so, yes, of course, telehealth visits, but how do you actually create an experience for people who have such a condition that's difficult to approach and manage, and make them feel supported within the new reality. So they 10x the number of patients that they could see, and support them with a plan of action and get everyone involved around the person to support them, in particular in the mental anxiety that COVID created and the isolation. And seeing that up close was just amazing.
That's awesome. One last question, just a reminder, on the business model side again, Judy Mitzlaff asks, who pays for the service, the individual or the insurer?
In our view, it's the same as a bank. You need an organization to set the rules of engagement. There's so much information on the internet. We need somebody with trust to set up their own view of templates and information that needs to be in it and resources that they recommend. And then the consumer is empowered to use it as much as they can. And but they don't pay for it. They're the users of a service provided by an entity. And we've worked with hospitals, insurance, pharma, patient organizations, specialized programs. It doesn't matter what the entity is, as long as they have end users who need support, advice, plan of action, data around what are they doing that you don't know about that may affect how you approach them. That's who we are working with.